Number 9. PARP inhibitors for prostate cancer.
With a 1 in 9 chance of diagnosis, the disease is an ever-present worry for men. Researchers are constantly looking for new options for prostate cancer resistant to therapies, including metastatic castrate-resistant prostate cancer, or mCRPC, which is considered incurable. Known for their success in women's cancers, poly-ADP ribose polymerase, or PARP inhibitors, have recently shown success as a targeted cancer therapy in men with similar BRCA gene mutations. While chemotherapy damages DNA as a way to hurt and kill rapidly dividing cancer cells, BRCA genes have a built-in backup plan to repair cancer DNA. PARP proteins fix this damage, allowing the cancer to grow. The inhibitor of PARP prevents repair, effectively blocking cell growth. FDA approved in May were 2 PARP inhibitors for treatment of mCRPC in patients with these DNA repair mutations. In clinical trials, these therapies have demonstrated improvements, such as a 66% reduced risk of disease progression or death. While prostate cancer continues to affect nearly 200,000 men per year in the U.S., the emergence of PARP inhibitors for this indication is an enormous advancement in the treatment of the disease.